every woman is going to go through menopause if they live long enough. And we're hitting menopause in our 40s, maybe early 50s, and then we could live for another 40 years after this. And it's like we're forgotten. Like, why isn't anybody telling us about our bodies?
Thanks for watching Hot Flashes and Cool Topics podcast. Be sure to subscribe and ring that bell to catch all of our conversations. Now, on to the show.
Welcome back to Hot Flashes and Cool Topics. Today we are talking to Dr. Sara Reardon. Welcome to the show.
Thanks for having me.
Well, your new book, Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage, is just something that women really need to take a look at. And we highly recommend it because you're very thorough. It is every age and every stage. So you talk from the beginning of the power of the period all the way through to post-menopause. And obviously our demographic is interested in the post-menopause era. But I thought maybe we could start with explaining. You talk about nearly 1 in 3 women suffer from a pelvic floor disorder, but I don't think every woman knows what their pelvic floor consists of. So can you talk
Right.
about that?
Absolutely. And I think that, this is every day I still meet people that say, "Oh, I've never heard of that." And I'm like, it's like saying you've never heard of like an elbow to me, because it's such an integral part of your body. We all know the pelvis, kind of those that ring of bones we see on skeleton models, or even if we put our hands on our hips, you can feel those bones, and that's your pelvis. At the very bottom of your pelvis is a basket of muscles that attaches from the front to back and side to side. And that basket of muscles is what we call your pelvic floor, literally the floor of your core. And it supports your organs, your uterus, your ovaries, your bladder and bowels. In the male body, you don't have a uterus or ovaries. Obviously, you have the prostate. So all genders have a pelvic floor. And then you also, in the pelvic floor muscles, have openings. One is for the urinary sphincter that helps keep in urine and then relaxes to empty. Another's for the anal opening to hold in bowel movements and then relax to empty. And then the third opening is the vagina for vaginal intercourse, menstruation, vaginal birth. So whenever we experience an issue in this arena, whether it's urinary leakage, frequent urination, straining with bowel movements or hemorrhoids, painful sex, even low back pain or pelvic organ prolapse, your pelvic floor muscles are a component and often the reason that you're experiencing those. And so we don't think of the muscles as the problem. We kind of like, oh, it's not an infection or, something like that. But we really need to evaluate the muscles as part of the problem. And that's really where pelvic floor therapy comes in.
Yeah, I think that's what floored, like your book, me when reading the book, how important it is to keep your pelvic floor healthy. And what are some of the things you shared in the book and you share with our listeners that you need to think about? Like you said, don't push your pee out.
Right,
I mean,
right.
these are things that I was like, oh my gosh. Like I was telling Colleen this morning, the importance of relaxing and holding in and strengthening. I said, I was putting my makeup, and after reading your book, I said, I was clenching my butt. And I
Right.
realized it. It came to, I'm like, relax your butt. What are you doing?
Bridget, you're not alone. There's a lot of butt
Yeah.
clenchers out there. So, I think that because we aren't aware that this part of our body even exists, we don't even know kind of like if what we're doing is helping it or hurting it. And we're not given this education, we're not told like how to pee properly when we're young women or what's normal for periods or even how to have sex. Sex ed is like, oh, sperm meets egg and then baby's made. And I'm like, that's not sex. So I think that a lot of this starts with just kind of a lack of awareness and then a lack of education. Some of the really common things that I educate people on the book are just like normal things that we do every day. So, how do you pee properly without damaging your pelvic floor? So, you sit down, you lean forward, you don't push. So, your bladder's a muscle that's pushing the urine out for you. So, you don't have to like push or strain because that can weaken your pelvic floor muscles and lead to leakage or, prolapse. With bowel movements, don't delay having a bowel movement. And I see this a lot with kids or like, busy working professionals who don't want to have a bowel movement in public. But when you delay having a bowel movement, it gets really hard and difficult to empty. And then you have to strain. And straining weakens your pelvic floor more than coughing, jumping, sneezing. Things we think about could cause leakage, but really just pooping wrong. and then using a stool or a squatty potty under your feet to put you in more of a squatting position for bowel movements. And then even things like when we lift, like when we hold our breath when we're lifting weights at the gym or pushing furniture or lifting our kids, all of that kind of holding and pressure causes weakness in our pelvic floor. And we see this happen a lot with birthing moms. So, Colleen, we were just talking about your daughter is expecting, and we're not told how to give birth. We're not taught. It's like we're asking women to go run a marathon and not training them to do so. And so they're getting into this really vulnerable and physical experience, and they haven't been told how to relax their pelvic floor muscles. And so they're pushing, they don't know they can change positions. They often end in a cesarean birth, which then they've like experienced so much physical change, and then there's no rehab for them afterwards. And then again, we see this in menopause with hormones changing and leading to painful sex or weakness or leakage. So again, every stage of life, these things can happen, and we've got to just know how to proactively care for our body so they're less likely to happen and we can get help sooner.
Right. When you said the birth, and I know we're going to focus later on the perimenopause, post-menopause woman. When I gave birth to my first child, no one told me to relax. And I mean, I pushed for ever, like over an hour. And I remember just tensing up really, really
Yeah.
badly. And I had to have a huge episiotomy. I mean,
Yeah.
and I thought if someone had just told me that, had just said, you don't have to, it's not time to
Right.
do that. And another thing, you mentioned the massage, how important that can be. And one of my sisters had a nurse that did that. She had her first child in Hawaii. Someone did that. She had four children, and one of them weighed 11 pounds, and she didn't have to have an episiotomy, and she didn't
Yeah.
tear. I mean,
Yeah.
And
it's
Bridget's
just
a little bitter about
I'm a
it.
little, and it's been 32 years, and I'm still mad about that. No,
And
but
it's so
yes.
you're not alone, and it's still happening. I mean, 32
Yeah.
years later, Bridget, it's still like I live in New Orleans, and there was a local childbirth education class where a nurse, who every person who gives birth at this hospital sees this video, a nurse was telling folks, you strengthen your pelvic floor muscles to the very end. Do all your Kegels during pregnancy so you have really strong muscles to push your baby out. And I'm like, your pelvic floor doesn't push your baby out. Your uterus does. Your pelvic floor needs to relax and get out of the way. But we're not taught this, and medical professionals aren't taught this, L&D nurses and OBGYNs. And I think that, I'm really hoping that this can start to shift. And even reading this book will help medical professionals as much as it helps women. It'll help the professionals that care for women to say, like, oh, this is interesting. Like, I didn't know this, and maybe I can start integrating it more into my practice, because what we see after birth and, during menopause and after menopause is like we see when things have already gone wrong, when things are already happening, but there's so much we can do to prevent it as well.
That's true. I think one of the things that is common for women as we get a little older is the peeing in the middle of the night. Once,
Yeah.
twice, 50 times, just depends. And you talk about the urge suppression techniques. Can we talk about why it happens and what we can do to keep it for that, suppress the urge?
So it's one of the signs of actually perimenopause that women don't even realize is happening. They're like, oh, I'm waking at night to pee now, and I never used to do that. Or I have to pee 3 to 4 times before I can like finally get to bed because I keep feeling the urge. So some of it is because a lot of it is because our hormones are changing. So we're having less estrogen and less collagen, and that changes kind of the vulva and vagina and urinary tract. So there's a lot of estrogen receptors in this area. And so what happens is when we have less estrogen is we have less strength, we have more sensitive tissues, we have more bladder urgency, and we're more risk of infections. You start to see urinary tract infections start to happen more often too. And so some of the things you need to do are from a medical perspective, use topical hormones on the area, use vaginal moisturizers, strengthen your pelvic floor, because if you tighten your pelvic floor, it actually tells your bladder to chill out. So some of the urge suppression things we tell people are, one, they don't even know how often you should be peeing. So what's normal is every 2 to 4 hours during the day to pee, and then at night 1 or 2 times max, sometimes none. So if you start getting outside of that range and going more frequently, then you're like in the kind of abnormal dysfunctional range. And that's when you need to start implementing urge suppression. So it's breathing, deep, big, deep belly breaths. It's doing pelvic floor or Kegel contractions. And you've got to know how to do them properly and have enough strength to do them effectively. And that quiets your bladder down. Sometimes it's distraction, like read a book, play on your phone, make a phone call, things that take your mind off that constant urge to go. Because if you keep going more frequently, your bladder will get used to like emptying when there's only a little bit in it. Because oftentimes if you go, you're like, oh, that wasn't that much, but I feel like I had really had to go. And then you go again, you're like, oh, that wasn't that much because your bladder's not really full. So using some of those urge suppression techniques can be helpful. And also again, like proactively keeping those tissues healthy so they don't get so irritated and feel like you have this constant urge to go.
Right. And then with the irritation, that when you hit this age, sex can be very painful. And you
Yeah.
address that as well in this.
Yeah, and it's so wild because, every woman is going to go through menopause if they live long enough. And we're hitting menopause in our 40s, maybe early 50s, and then we could live for another 40 years after this. And it's like we're forgotten. Like, why isn't anybody telling us about our bodies? And especially the pelvic floor goes through so many changes. And so I mentioned estrogen declining, and that causes, when you have a lot of estrogen in your body, you have thicker pelvic floor muscles, you have more endurance of those muscles, you have more vaginal lubrication. Think about when you're like pregnant, it's like a water faucet down there, right? There's like so much discharge and lubrication. And then when you're in menopause, it's like a Sahara desert, right? Because you don't have as much estrogen anymore. And so that can lead to painful sex, vaginal itching, irritation. Your labia can start to get really thin and kind of almost resorb. Your clitoris can kind of start shrinking and get like stuck. And all of this is because of hormonal changes. So what's mind blowing to me is we know women are going to go through this and we're not giving them support before that happens. It's like we tell women to strength train for osteoporosis, to manage their blood sugars and cholesterol, and for diabetes management. But I'm like, nobody's telling us how to take care of our vulva and vagina, and which we know is going to change. And so that thin, dry tissue can lead to painful sex. And so, again, using a regular moisturizer for the vulva and at the vaginal opening, I really recommend using something specific for the vulva. And there's a lot of them out there now because you have a pH balance in this area. And when you put something in it like petroleum jelly, or even coconut oil, it changes the pH and that puts you at risk for infection. So something really specific for the vulva externally, using again topical estrogen that has to be prescribed by your medical provider. If you don't want to use estrogen, you can use these DHEA suppositories, which is a precursor to estrogen, but doesn't have that kind of local, it can lubricate the tissues and help plump them up. Do your pelvic floor strengthening, find a great lube to have sex. Vaginal dryness doesn't mean you're not aroused. It just means you might have low estrogen and low blood flow. And so, I think we just need to help women better understand their bodies and their partners so that they can navigate these things. Like, I don't want 40 years of my life to have be like that I'm having painful sex or leaking. I'm like, we deserve better than that. And there's definitely solutions.
Absolutely. Thank you for sharing that
Yeah.
because there's so many of our listeners contact us and go, sex is painful. I
Hmm.
don't want to have sex. And then it's not just physical, it's mental.
Yep.
Then the mental block makes you avoid it. And there's just so many layers to the
Hmm.
conversation. And you were saying that there are things we can do with local estrogen and what preventatively? You said there's an element of prevention. What can
Yeah.
we do with that?
So, the other thing I kind of failed to mention is when you have low estrogen, you also have a low libido. So it's just they're connected. And also low testosterone can lead to low libido. So if you're having pain, it's like, why would you want to do something that's not comfortable? So like again, to your point, we're layering on another factor that like makes us not want to be sexually active. And then we carry this burden of like, we dread it, or should we endure it, or we feel like we're not, our self-esteem changes. So again, it's our bodies are changing, but yet the ripple effects of that go really far. I think that if we talk about what we can do proactively, you don't have to wait until menopause, for your period to stop for 12 months to start using the topical estrogen. Start using it in perimenopause and you use it twice a week forever. That will help plump things up. Use your vulva balm and vaginal moisturizers very regularly. Just like we put on skincare on our, all the products on our face, like have those products that you put on after a shower the days you don't use your topical estrogen. You can strengthen your pelvic floor muscle. So if you have weak orgasms, if you feel less sensation in the area, if you feel like things are just weaker down there, or you want more blood flow to the area, strengthening your pelvic floor. But the other thing that's really important is that oftentimes when women have low estrogen and they're not sexually active or they've been avoiding it, their vaginas tends to stenose. So what that means is it starts to close in and get tighter. And then when they try to insert something, it feels like they're tearing or ripping. So there are these devices called vaginal dilators, and they look like tampons of different sizes. And I go through this in the book on how to use them is you train yourself to kind of insert one, and then you just like let it sit, do some movements with it and move it in and out. And then as your tissue starts to stretch and accommodate, then you go up a size. And then as that gets easier and more comfortable, then you go up another size. So it starts to kind of open up the vaginal opening so that you're closer to the size of your partner or whatever you want to insert. And this goes for even like not just sex, but medical exams. I mean, if you have to have a gynecological exam and inserting a speculum is painful, that's a healthcare concern. And so we have to help women train themselves how to keep these muscles and tissues open, how to be, and you can use that with vaginal dilators at home too. So, it's like, again, it's like stretching before a race. It's just like these are muscles and tissues, and we do this for other parts of our body, just not our pelvic floor because we haven't been educated on how to do it.
Right. It is so important in there. And just like you said, for all the ages, just like having topical estrogen to prevent UTIs. I think
Yeah.
that is so important. We've had several physicians on here that said, I don't care if you're in your 90s, if you're in a nursing home in your 90s, because then a UTI can become septic and you
Yeah.
could die. It can cause a lot of issues. And
Yeah.
another issue that is so important that I've heard from different people is the problem with leaking poop when you get older. I
Yeah.
mean, your book was probably one of the first I've read that really addresses that and how that is a really big concern. And I feel
Yeah.
terrible for these people that this happens to. What are some suggestions for women who are experiencing this?
It's interesting because one of the most open newsletters that I have and one of those read blogs on my website is skid marks in your underwear. It's like,
Yeah.
and I always kind of approach these topics like we're not looking up fecal incontinence. We're looking up skid marks in our underwear because these are real things that we are experiencing and they're very private and embarrassing. And they keep us from exercising, from traveling, from being intimate with partners because we don't know what's causing it or how to navigate it. There are a couple of things that can contribute to this. So we actually see a lot of some fecal incontinence or leakage or staining after birth. And this happens if you have a severe tear in the vagina it's called a grade 3 or 4 that goes into the rectum and goes into the kind of anal sphincter. And you typically have scar tissue or weakness in that area from that tear. So we see it a lot for postpartum moms if they've had a more severe tear. The other thing is it can also happen with hemorrhoids. So hemorrhoids are like prolapsed veins. So if people are straining and they feel like they can't clean themselves really well, they can often have staining in their underwear. But then kind of the urgency to poop and then you feel like you can't make it there in time. It happens often with muscle weakness. And what happens to our muscles as we age? They get weaker, right? So we encourage women to go to the gym and strength train and build up your muscles but we also have to do that for our pelvic floors because that anal sphincter is part of your pelvic floor muscle and you have to be able to contract it and hold it and you need like 20 to 60 seconds to get to the bathroom. So you need enough endurance in your butthole muscle to help you get there in time. So working on endurance contractions of the pelvic floor, and not just like when you're sitting at your desk, like you need to practice them while walking, while standing at the toilet, like while in an upright position. The other thing is a lot of foods that we eat can start to make our stool, our poop really loose. So looking at what you're eating, if you're like taking a medication that causes loose stools, if you're having too many greens or chia seeds or, things like that, it's like trying to hold up applesauce versus trying to hold up peanut butter, right? If it's applesauce, it's just going to be harder to hold in. You compound that with weak muscles and you've got leakage of stool. So things like that, I think, are really important to address. And then also making sure that you're emptying completely. If you're going to if you're pooping two, three, four times a day, and that means you're not emptying when you go or your poop is too loose. And so bulking up your stool, but then also making sure that you using the squatty potty, relaxing your pelvic floor muscles, emptying all at once will make sure that you go at one sitting instead of multiple times throughout the day.
I think a more common thing that women complain about is constipation.
Yeah.
And I'm a member of that club. Everyone knows it. I've talked about it before, but a lot of times people will say, "Well, you're clenching your muscles too much. You're making your pelvic floor too tight." How can you work on, I loved in the book that you talked about massages and
Yeah.
relaxing that area, but what can women do when they are just like Bridget said when she was sitting and it just tight? Naturally,
Yeah.
they tighten.
So many of us are tight, and this is something I experience myself. And constipation is hands down the most common GI complaint, gastrointestinal complaint in the United States. It's a combination of inactivity, side effects of medications, foods we eat, dehydration, and then tight butt muscles, right? So, the best position to relax your pelvic floor, which is again is your anal sphincter as well, is a squatting position. So I would encourage you to do like deep squat stretches, not up and down, but getting into a deep squat and holding that to release that muscle. You can do this lying on your back and bringing your knees to your chest and keeping your knees nice and wide. You can do what's called a child's pose where you kind of get into hands and knees and rock your bottom back on your heels, and that like opens up your pelvic floor. You can stand at your desk and squat down and kind of get into that like low hover and just hang out there. I tell people to do that while they're brushing their teeth. If you have prolapse, don't do that. But if you just have tension, I say do it while you're brushing your teeth. That's twice a day. You do it for 1 or 2 minutes, and that's your stretch. But that helps relax the pelvic floor muscles. Also, as we mentioned with Bridget, like you got to stop clenching, right? You got to tune in, and it's hard to be like relax, butthole, relax, but just breathing helps soften your pelvic floor. So if you sit upright and you put your hands on your ribs and you take these big, deep breaths, breathing into your ribs, that moves your diaphragm. And moving your diaphragm relaxes your pelvic floor naturally. So just breathing, like try tightening your pelvic floor and taking deep breaths. It's really hard to do. But if you can take some deep breaths, it kind of forces your pelvic floor muscles to let go. And just doing that a few times a day can kind of like reset, like, oh, I need to let go. And then that relaxed state starts to be more of your pelvic floor resting tone versus that kind of tight, tense state.
You brought up prolapse, and that is another issue that happens to women,
Yep.
really, I guess, really post menopause, but it can happen, I guess, anytime. Can
Yeah.
you talk about what that is and what are some things we can do about that?
So prolapse is when our pelvic floor, that kind of basket of muscles, isn't supporting our organs as well. And it could be because the ligaments of those organs get stretched out. That happens with pregnancy or with chronic straining, like heavy lifting or straining during childbirth or even straining with constipation. Or your pelvic floor muscles, that hammock is not as supportive. Again, that happens with pregnancy, after birth, aging, menopause. And so we actually see some women having prolapse when they've never been pregnant or given birth because they may chronically strain with bowel movements or they push when they pee. So when your organs aren't as well supported by that hammock of muscles, your pelvic floor, they start to push into the vaginal walls. And it can feel like heaviness or pressure in the vagina. It gets worse at the end of the day or with standing. It feels like tissues like rubbing on the inside, like of your vagina, like something's like tissues rubbing. It's because your organs are kind of pushing into your vaginal walls. It can feel like a bulge at the vaginal opening, like if you're showering and you feel that. And it's all due to a lack of support. So you have to, one, stop straining. So I would look at what you're doing. Stop pushing when you pee. Make sure that you're pooping. And I tell people to support the perineum, like put toilet paper on their hand and hold the vagina up while they're pooping so that the pressure doesn't go into the vagina. Making sure their bowel movements are soft. If they're lifting, whether it's again your grandkids, your weights at the gym, make sure you're not holding your breath because holding your breath can lead to pressure down. So stop straining, start strengthening. Sometimes people have tension that needs to be addressed first, but then after that, you need to start strengthening your pelvic floor muscles, doing more endurance Kegels, like holding for 10, 20 seconds. You've got two different types of muscle fibers. So just doing Kegels up and down isn't going to help work those endurance muscle fibers. And your prolapse is often caused when the muscles get tired and weak. So you need to do those endurance Kegels. And then you can also consider supports. So this could be something internal like a pessary, or there's some over-the-counter supports. I even say you can use a tampon. And there's external supports like kind of tight underwear that they look like jock straps for your vagina, but they just kind of give, it's almost like when you have prolapse, you feel like you need to put your hand on your vulva and like push up. And this underwear does that so that you can go hiking, stand up at work, go for walks, like still function and be active without that heaviness or pressure feeling.
Yeah. There's
And
a lot of products for that too.
but
Yeah, that's
It's
amazing.
amazing.
women either don't
Yeah.
understand what's happening or they're embarrassed to ask their doctors or
Yeah,
friends about it, so they don't even realize their products,
right. There's
unfortunately.
so many. And I think that that's the thing is that, the research is very clear. If your medical provider doesn't ask about an issue, we're less likely to tell them. So if you're checking in once a year with a primary care doctor or an OBGYN and they're not saying, are you leaking urine? Do you have staining in your underwear? Do you have discomfort with intercourse? Are you feeling pressure or heaviness in your vagina? Like, then we're not going to bring it up. And so we go down these rabbit holes sometimes on social media or on Google, but we don't really know what is even going on. And so, again, many, many women will experience prolapse, often because of giving birth or menopause and hormonal changes. But these conditions are very manageable and very treatable. And even if you have surgery for prolapse, which a lot of my patients do, you need to be doing therapy beforehand and therapy afterwards because there is a high likelihood over 30% of patients who get a prolapse repair will have a repeat surgery in 10 years because we're never teaching them how to improve their muscles. We're just kind of like pulling everything up, but we're not teaching them to stop straining. We're not teaching them to start strengthening. We're not teaching them to exhale with exerting effort. So all of the things that led to that were never addressed, and it's going to happen again. And so I'm just so, when we go get a back surgery, it's like we get physical therapy before, we get physical therapy in the hospital, we get home health when we go home, then we go to rehab for months. And I'm like, women have vagina surgeries or C-sections, and they're just like, good luck.
Oh, yes. I had
Look,
two
yeah.
Here's some
C-sections and
ibuprofen,
yeah, I don't remember.
like what?
I don't remember them giving me any options when I had my C-sections. With the options that are now available, and that's wonderful, are they covered by insurance?
So physical therapy for the pelvic floor is just like any other type of therapy, physical therapy. So if you have insurance, you can, and it's got physical therapy benefits, you can use it. However, many pelvic floor therapists don't take insurance. And so, well, you can file for what's called out of network. Like my dentist is out of network. She's not on my insurance plan. So, she gives me this like what's called a super bill and I send it to my insurance and they reimburse me. So that's really one of the, I think, bigger challenges for pelvic floor therapy. So it's totally can be covered by insurance if the clinic accepts insurance. One of the challenges with this, and I think it's really frustrating for patients and women, is that they're like, I've got insurance and I can't use it. I'm like, insurance companies reimburse us like $30 an hour to see a patient. So we only see patients one at a time in pelvic floor therapy. We can't have two to three patients in a gym that we're working with and then a tech comes in and helps. It's like one on one. And we can't sustain that. And we can't spend one on one time with our patients if we're getting paid $30 an hour to cover all the costs. And as PTs, if you see, three to four patients an hour, I mean, you're totally burned out. And so a lot of therapists, and including myself, we kind of chose this out of network model and not taking insurance so we can have one on one care. We can have an hour with a patient and we see them once a week or once every other week. It's not three times a week you're going in. And then we're really big on giving you things to work on at home. And I think that that's where Floored really comes in the book because not everyone can access this care. There's not enough therapists. It's not always accessible near us. The wait lists are long and it can be costly. So, my book is really an effort to give people this information and to get them resources and exercises to start doing things at home, whether they're waiting for PT or they just want to give this a shot before seeing an in person therapist.
Yeah. I mean, one of my favorite quotes in your book is that pelvic floor issues are common, but they are not normal. And I thought that just applies to so much in women's health care.
True.
Yeah,
It does. Yeah.
it
You
really
do
does.
have in the book towards the end the pelvic floor toolkit, which is
Yeah.
really helpful. Why was that important? Was it important to include that in the book because of what you just said, that not enough women have access?
Totally. I mean, I think that my book is just kind of one option for folks. I think, again, the great thing about medical care right now is that we have options. It's not like the only option is going in to see an in-person therapist. You can do telehealth, you can do online fitness programs. Like I have an online workout program for the pelvic floor, for menopause, for pregnancy, all of these things. And then you can have a book. So I think it's important for people to have options for how they access care. A lot of what I do in the book is kind of give you things to start at home, whether it's using vaginal dilators or doing perineal massage during pregnancy or using a stool to poop at home. And I wanted people to have like the direct links to those. So, like, hey, this is where you can get these products. And these are products that I have. I mean, I've always felt like I was really lucky that I just chose this field and then I got to kind of understand my body and do things to proactively take care of it. And I was like, well, this isn't fair because every woman deserves this education. Like, why did I just kind of get lucky and pick this path? I think everyone needs this information. And that's really my goal is to help people, whether they're treating women or whether they are a woman or whether they have daughters or moms or siblings or whatever, to really just help us better understand our bodies, how to start treating issues we might be experiencing, how to prevent them, and then also to feel really empowered to go talk to a medical provider if you are having a problem and like trusting yourself that like, nope, Sarah says this is not right. And I'm gonna be like, hey, doc, I want treatment for this and you deserve that.
You want them to be able to say the vagina whisperer said.
Yes.
Like
Yes.
I'm
I
like
love
blame it
that.
on me a
I
hundred
love
percent
that.
like throw me under the bus and I'm like I will go to bat for you and be like no I mean for this book, I include patient stories of, I've been practicing for 18 years and I include a lot of patient stories. And I think that that's important because often the women I see feel very alone. They're like, am I the only one experiencing this? Do other women have this problem? And I'm like, 100%. Again, common, but not normal. And so I think it really humanizes the experience that we have and also the effect that pelvic floor issues can have, whether it's not being able to get pregnant because sex is painful, not traveling with aging because you're afraid you don't have access to a bathroom, relationships struggling because you can't have sex, your mental health struggling because you can't exercise and run like you used to before pregnancy. I mean, there's just the ripple effects of these problems go really far. And, I think it's just important to kind of see how impactful pelvic floor issues can be in our lives and really how awesome it can be to help women overcome them. And I hired a research assistant and just poured myself into the research because I was like, I want everything that I'm giving women to be backed up. So when you do go to your doctor and say, like, no, this isn't normal, or this is, what's recommended, like you've got science behind you to back that up.
Right. Like just, you mention a woman in the book that the doctor tells her, don't lift heavy things.
I
And she's
know.
got a child, she's got a
She
baby.
had a
Like,
child, and she's a nurse,
and she's a
who's
nurse
lifting
too,
patients. And I'm
patience.
like,
Yeah.
can you
Yeah.
imagine? I mean, you're telling her just to like, oh, you're cool, it's not cancer, but you're like, but wait, I can't even function or work or mother, and you want me to just deal with it until surgery. And I'm like, there are so many more in between steps we can do to help women navigate that experience.
And
Yeah.
knowledge is power, even from the very beginning of your book, where you explain to women, grab a mirror, learn your vagina. It's not scary. So many women have no clue what is down there. They use words, they have no idea where their clitoris is, the vulva, anything. So starting from scratch, literally, it's so helpful for women because this is taboo and they don't feel comfortable saying that they don't know what their vagina looks like. So
Right.
it's wonderful that you start the book really simply saying, just learn about your body, because
Yeah.
then knowledge is power.
It is. And it's not our fault. I mean, we were never educated on this. And we were often told that this part of our body is gross or embarrassing or private or not to be discussed. And so when we grow up with that narrative, it's easy for us to kind of distance ourselves from it. And then even if you go through trauma, again, that's another layer of just kind of like not wanting to deal with down there. And so I think it's really about kind of peeling through those layers to say, like, the more we talk about it, the more I connect with my body, the more I can advocate for it. I can feel less ashamed about it. But it's a really complex situation because it's not just like, hey, you don't want to look. I'm like, hey, we've been told that we shouldn't even touch it. And I'm going, you're going to a medical provider or you're having a sexual partner that like they've seen this part of your body more than you've seen this part of your body. And if you don't know what's going on down there, it's hard for you to assess like what's normal. Like if your labia start to disappear during menopause, you're like, well, I didn't know what my labia looked like before, you know? So it's like, it's just kind of important for us again to know our normal so we can take steps when something's changing.
Right. And you have some great diagrams in the book as well. I mean, I think it really is very helpful to show what needs to be done and what things are going on down there. And then I have to talk about the Vagina Whisperer. And you had in there like a thing, like, I want to have I forgot what you called the race, but
Running up the vulvas.
the running of the vulvas. I was like, I used to run. I haven't run in years, but I might just get a pair of running shoes and the vulva suit.
It's so funny because I was talking about this and I've had so many people being like, I'm coming. I'm like, okay, Sarah, you better get this together for 2026, because it's one of those things. Well, I live in New Orleans and we're a wacky town. And like they would be like, yeah, let's do a running of the vulvas and people would come. But the other thing, it's like we really do have to kind of shout from the rooftops, like, hey, take care of us because you're not. Like we are getting left behind in research and healthcare and reproductive rights and maternal health care and menopausal care. I mean, so we have to be the ones that say, like, we deserve this and we're demanding it. And I feel like that's only one of the ways that's going to be one of the ways that we can move the needle. And so I think we just have to keep pushing for it because if we don't do it, then who's going to? So,
Right.
yeah, everybody start getting your vulva costumes ready for that race.
Did you make that? How did you get this vulva
I
costume?
wish. This was back in like 2018 when there were a lot of women's marches going on. And I just went online. I have a twin sister and she's in marketing. She's like, you need to do something big when you hit 10,000 followers on Instagram. And that was back then, like when you could like include links.
Right.
And so we started looking online and it was either she or myself found that. And that company went out of business. And I've
Oh.
tried to contact them so many times to be like, please make more. Like I have one and my kids like start rolling around in it. I'm like, get off of that. Like that's my whole brand. So I definitely need more in my closet. But yeah, we've got to find a new supplier for the vulva costumes for the masses.
So true.
Awesome.
And on that note, people should be following you at the Vagina Whisperer on Instagram because you have so much great information. Knowledge is power. And the fact that you speak to women in very clear terms in this book and you answer the questions that we have that we're afraid sometimes to even ask our doctors is really appreciated. So thank you so much, Dr. Sara Reardon, for coming on the show.
So thanks for having me.